May adlaw na tong tanan. Is your arm swollen, heavy, and difficult to move after being paralyzed because of a stroke, traumatic brain injury, spinal cord injury, or if you have multiple sclerosis? In this video, I'm going to show you on how to manage that swollen arm without medication and at the comfort of your home. Hi, I'm Nathan. I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. Swelling of the arm is common after a stroke, and that will make your arm feel heavy and difficult to move because everything will be very tight. And this is commonly caused by lack of movement. And that will also result to the impaired flow of the lymphatic fluid, which will lead to the fluid buildup around those areas where you are not moving. And this is called peripheral edema. As soon as you notice any signs of swelling, tightness, or discoloration of the arm or leg for that matter, please call your doctor immediately to get the proper diagnosis and so that he can prescribe you the proper management on how to deal with that swelling. Now enough talking, let's go to the proper management and massaging of that swollen arm. And just follow along until the end of this video. Alright, for this video, my swollen and affected arm will be my left side, my left arm. And I have drawn an X on my hand and my wrist. Now, this does not indicate that I am underage, but this is just so you'll know which arm is affected, okay? And the first thing that we need to do for the management of your swollen arm is deep breathing. Deep breathing will stimulate the lymph nodes in our belly. Okay, so we have a lot of lymph nodes here in our belly. So we're going to divide our belly into 4 areas. Okay, so since this arm is unable to move, I'm going to just use my right hand. Okay, so I'm going to push on the right upper quadrant first. Inhale and push against your hand when you inhale, and then push down when you exhale. Okay. Let's do that one more time. Inhale, exhale. All right, that is just so you understand the process, okay? Now we'll just do one on each quadrant now, okay? Upper left, inhale, push against that hand. And exhale, push down a little bit. Lower right, inhale, push down, exhale. Lower left, inhale, and exhale. Now we're going to stimulate the lymph nodes around our neck. So there's a lot of lymph nodes under our jawline and just above our collarbone, okay? So again, I'm just going to use my right unaffected side, okay? So first we're going to stimulate here, the right side of our ear, okay? So you're going to make this sign right here like you're an alien, all right? So just going round and around here. You can also go up and down. All right. So you're also going to stimulate under the jawline, about 8 to 10 swipes. Okay. Just like that, and do the same on the other side. Okay. Alright, now we'll go just above our collarbone. Okay, I'm going to be very careful because it might be distracting if I touch the mic, my lapel mic. Alright, just like that. Now in this side, I might use the back side of my hand because it's hard for me to go this way. It might be hard for you too. So just like this. Okay, about 8 to 10 swipes. All right. After that, we're going to stimulate the lymph nodes under our armpits, okay? So to stimulate the lymph nodes under the arm of this affected side, you're going to just insert your hand there and just go circles. Okay, under your arm. Just like that. About 8 circles. You don't have to push hard, just light to moderate pressure. All right? Now, since your affected arm is difficult to move, you can massage the underarm of your unaffected side. So you're just going to raise your arm up and then squeeze down. Okay? Raise your arm up, squeeze down. Just like this. All right? About 10 times. All right? Or you can also go this way. Chicken wing. All right? So let's do 5 more. 1, 2, 3, 4, 5. All right? Now we're going to stimulate the lymph nodes at your inguinal area, or the crease between your trunk and your leg. Okay? So that is your groin area. Okay? So using the palm of your hand and your fingers, you just go up and down or in circles. All right? Just like that. After you do these exercises, I hope that you will feel relief and you will see your swollen arm shrink. Right? Let's go to the other side. Just at the groin area, about 8 to 10 circles. All right? After doing that, we are going to swipe from the underarm of your affected side going to the underarm of your unaffected side, or your moving hand, moving arm. Okay? So you're just going to pull this way. Okay? About 8 times. 3, 4, 8 to 10 times. This is 6, 7, 8, 9, 10. Now we also massage from here, from your underarm. Try to put your hand there, going down to the groin of your affected side. Okay? Just like this. All right? About 8 times. Just follow along with me here, okay? Now, we are going to massage our arm, and we are going to divide our affected arm, our swollen arm, in 2 areas. So, the shoulder, the upper arm, the forearm, and then your wrist and hand. Okay? So, I'm going to bring a table here so you can see better, and it is also better if your arm is supported. Okay? Alright, now we have a table. So, let's put our arm on the table. It is better when your arm is elevated when you're doing this massage for your arm. I know it might be difficult for you to elevate your arm like this, but do your best to be gentle in putting your arm up on the table, okay? So, put it on a throw pillow or a regular pillow on top of the table so you're more comfortable. So, let's start from the shoulder. So, we're going to use our entire hand in massaging, okay? So, let's start from the back, okay? Going down to your armpit, okay? About 8 to 10 swipes again. Just like that. If you can ask somebody from your family, or if you have friends who are very helpful, ask for help. Show this video and tell them to just follow along, okay? It's so much easier when you have 2 hands to do this massage and this management, okay? Now we're going to the upper arm, all right? So we're just going to swipe up from the front first, 8 times, 8 to 10 times. And then we go to the side. Okay, and the inside, okay? Going the inside, it might be hard to go this way, so use the space between your thumb and your index finger going that way, okay? About 8 to 10 times again. Now you might notice that there is more swelling just above the elbow right here, below, or the lower part of your triceps. Above the elbow, there will be more swelling there, and that is because of there's more creases where the lymph fluid is blocked. So you're going to spend more time there, all right? And just massage going up. It is important to note that when you do this massage to get rid of that swelling, you need to go up. You can't go down. Because if you go down, there's nowhere else to go, right? And we are going from the top to bottom approach, because if we start from here and there's blockage here, it will only be clogged up there. Okay, so just follow this way. All right, then you're going at the elbow area. There are some lymph nodes there too. You just go in circles, about 8 to 10 circles. Then we go to the forearm. If you can bend, it is better if you can bend your arm, but if you can't, it's okay. Okay, so you just massage. I'm going to bend it so you can see better. Okay, so you're just massaging section by section, 8 swipes. Okay, so I'm covering this side here. We call this the lateral aspect, and half of the back side and the front side. All right, if you are down there and you have a hard time bending your elbow, just slowly roll your arm. Okay, then just find a way to gently swipe up. Okay, going to bend it again so you can see better. 8 to 10 swipes. I don't know why I can't pronounce 10 anymore. So 8 to 10 swipes. All right. So after that, we are going to the wrist and hand. Okay. For the wrist and hand, just use your thumb and your fingers. Okay. So we start from the palm and the back of your hand. So you can use your fingers for the back side and the thumb for the front side if you're able to bend. But if you can't, just do one side at a time. All right, so one side at a time like this, and then try to roll your arm for the back side. Okay, just like that. So after 8 to 10 swipes, now I'm able to pronounce it better, we go to the fingers. So use the fingertips of your unaffected arm, unaffected side, like that. Okay, about 8 to 10 again each finger. Go back and front, side and the other side. Okay, go to the middle finger, and the index finger. And don't forget your thumb. If you can't open the thumb, just try to insert 2 fingers of your good hand and try to stretch it out. Okay, and then massage. Gentle, light to moderate massage. Okay, in this video it might look exaggerated just so you can see better, but like I said, it should be just light to moderate pressure. Okay, now after massaging your hand and fingers, you go back we don't stop there. So we're assisting the lymph fluid flow back to our underarm. All right? So massage again. Again, I'm bending my arm so you can see better. If you had a stroke, it might be difficult to do that way, so put it on the pillow, okay? So massage, massage. I hope you're just following along, you're not skipping the video. If you reach this point, type down below, present, okay? I'm going to do an attendance check. Type down below, I'm here, or present. I will know who's following along and who's not, all right? So after the forearm, we go up again, spend more time at the elbow area, and at the bend of that elbow, spend more time there, and then to the upper part of your arm, your biceps area, the inside, do not forget the inside of your arm, and the back side of your arm, 8 to 10 swipes. Now I'm getting the hang of that word, that number 10. All right, go up, shoulder area, okay? And after doing this massage, try to stretch your shoulder, your elbow, your wrist and hand. Try to move that arm. See if you're able to do the exercises for your stroke arm after doing this massage and after shrinking that arm. You will see that you might have more wrinkles. It won't look as shiny. This is the only time that you would like to see wrinkles on your skin of your affected arm. If it is still shiny, that means you are still swollen, but give it some time. Spend about 15 to 20 minutes to do this massage, okay? All right, that is how you massage and shrink your arm if it is swollen after you had a stroke or after you are paralyzed. Now, I hope that this video is helpful for you. I hope that you're able to move that stroke arm better or stretch it a little bit easier without feeling too much tightness around the joints. And if you find this video helpful, please click on that subscribe button, give it a thumbs up, and click on that notification bell so you will know if there are new videos coming out from this channel. And just a reminder, consistency is the key and never give up. Until next time, paalam!